Hello everyone, this is Dr. Jawad. I'm going to answer an email question, and that is, I have acute prostatitis. I don't want to take antibiotics. What can I do? What can you do to help me? Before I do that, if you're new to my channel, thank you very much for watching. If you haven't done so already, please hit the subscribe button down below and right next to the bell notification, because when I upload videos like this, you'll be first to be notified. If you're watching on Facebook, thank you very much. I always appreciate growing audience. Again, if you find this information valuable, please share with a friend and hit the like button down below. It helps YouTube, Google, the internet, a logarithm to broaden my audience, and I always appreciate that. Thanks for watching. Okay, so I'm answering an email from a gentleman who asked, I have acute prostatitis. I don't want to take antibiotics, so what can you do to help me out? Well, let's back up a little bit. What is acute prostatitis? What's prostatitis anyways? Well, males get it. It's a prostate gland. And it could be inflammation from either an infection or it can be just inflamed by non-bacteria. So there's two types that we're looking at. One, if it's bacterial, it's the same bacteria that is typically found from a urinary tract infection, and that's E. coli, Klebsiella, protease. Or it's non-bacterial, meaning, okay, you have an inflammation of the prostate gland, but it's not bacteria-based. It could be something else. Now, there's four types of prostatitis. One, acute bacterial prostatitis, which typically hits males at about the ages of 20 to 40. Next, we have chronic bacterial. Now, it's reoccurring. Somehow, you just can't get rid of it. You have inflammation of the prostate gland, and it just doesn't go away. Or you have chronic bacterial, chronic pelvic pain. And this is most common, especially with the ages of men over 40. What happens? You have pelvic pain and other symptoms, but the symptoms are not due to the bacteria infection. It could be due to something else. Or it's asymptomatic inflammatory prostatitis. It's inflamed, but there's no symptoms. So what are the symptoms about it? What symptoms can you have? If it's bacteria, you're going to have, like a UTI, it's going to present with fever, chills, frequent urination, pain with urination. Maybe you're getting up at night to pee a lot. Now, if it's chronic, this is where you add the low back pain and the abdominal pain. In addition, you may have pain with ejaculation. It may be persistent, it could be mild, it could be episodic. Okay, so there's different types of prostatitis. Now, what are the causes of it? Well, the main cause that you're going to get, it's bacteria from the urine that leaks up back through the urethra to the prostate gland, and that's how it gets inflamed. So, or you'll have a bladder infection. You'll have a catheter. Sometimes poking through the catheter may inflame the prostate gland. Or you may have had a biopsy of your prostate gland, and something happened, and it got inflamed, because the prostate gland is a very, very soft. It looks like it's about the size of a walnut, and it should feel nice and boggy. What can you do about it? Well, how you diagnose it is typically through a rectal exam. You want to do a pelvic exam and you want to do a rectal exam, but you want to be very, very gentle, because if it's inflamed, it's going to be a stinger. You want to do a urinalysis. You want to look for the white blood cells in the urine. It may be a little bit frothy. And then if it's bacteria, you want to do a blood culture to verify that what type of bacteria it is. Now, the typical treatment protocol would be antibiotics. But what if you don't want to take antibiotics? Or what if you want to be preventative? Well, one of the things you can take is quercetin. Quercetin is a phenomenal anti-inflammatory for the whole body. It's a flavonoid antioxidant. It will help rid the body of free radicals. Natural anti-inflammatory. 500 milligrams twice a day for at least 4 weeks. Next, saw palmetto. Saw palmetto is phenomenal for overall prostate health. Why? Because it binds to receptors in the urinary tract, which will help decrease the inflammation. I always say it keeps the hoses clean. And the good thing about saw palmetto, it has no drug interaction, so it's safe to take. Next, bee pollen. Bee pollen is anti-inflammatory, it's analgesic, and also too, it's an androgen effects, which was going to help do, it's going to help stabilize the testosterone levels. Now, bee pollen, yeah, it comes in a capsule, but also comes in a powder form, and I always recommend just sprinkle it on a meal, or if you want to just swallow it, because you want to take 1 teaspoon 3 times a day. And you can take bee pollen for your overall health because it is a natural anti-inflammatory. Supplements, vitamin E. Vitamin E is always phenomenal as an antioxidant. Vitamin D3, 10,000 IUs, is good for everything. Selenium, 200 micrograms a day. It's good as an anti-inflammatory. It's good to keep the, for an antioxidant to help get rid of the free radicals. Diet's very important because when it comes to the prostate gland, there are estrogen receptors on the prostate gland which will cause it to inflame. So what you want to do, you need to decrease the estrogen-based foods. So you want to avoid the pro-inflammatory foods, and that is refined sugars, wheat, gluten, artificial sweeteners, spicy foods, acidic foods, alcohol, caffeine. All of this, not forever, but just until you decrease the inflammation. Why? Because these foods are all triggers. Next, you want to add in the anti-inflammatory foods, because those were the pro-inflammatory foods. So you want to eat vegetables, mainly cruciferous vegetables, broccoli. Broccoli, the cruciferous vegetables, has a phenomenal prostate health effect. Fruits, especially berries. High fiber, beans, legumes, or grass-fed, organic grass-fed beef, organic grass-fed chicken, organic grass-fed turkey. Also too, foods high in omega-3, which is wild-caught salmon, for example, walnuts. In addition, foods high in zinc. Zinc is phenomenal for the immune system. It's good to keep everything moving. Pumpkin seeds, cashews, high in zinc. In addition, you want to do lifestyle changes. You want to do lifestyle changes because the main goal is to, when you're exercising, you're producing a whole bunch of endorphins, which will help rid the body of free radicals. In addition, you want to do any type of exercise that's going to help build that pelvic floor. Because when you build that pelvic floor, kind of like Kegel exercises, it helps stimulate the muscles around the prostate gland for overall health. In addition, you want to lower stress. Now, I know that's hard to do, but you want to do the best thing. You want to be the best way possible to lower your stress levels, and in addition to get at least 7 hours of sleep. So I hope this helps. Again, for prostatitis, whether it be acute prostatitis, chronic prostatitis, you want to take care of your prostate health, because what happens if it gets enlarged, if it gets too bad, you may have to do surgery, you may have to remove it, and you don't want to do that. So I hope this helps. Please leave your comments down below, and I'll see you in the next video. Be good.